Okay, so in this video we're going to do intramuscular injection in the deltoid. Okay, so before preparing the medication, we need to do the 6 rites of medication administration, which is patient, dose, drug, documentation, time, and route. So now we need to check the order, and it says that he will be getting Minomax. So like a vaccination, which is 1 milligram intramuscularly now. The vial contains the drug 2 milligrams per milliliter. Okay, so we will be giving the patient half a milliliter of this medication. So we need to inspect the vial for any cracks, any abnormal findings like discoloration, all of that. If it's cloudy, if it's a multi-use vial, you need to make sure if it's like the expiration date, the time and initials of the nurse that used it last. And they are good for about 30 days, so like a month almost. Okay, so select the right needle for the this one's a little bit big for a deltoid, but it depends on the person, you know. If they're skinny, then you'll want a smaller one, less big. If they're like heavier, then you want a longer, thicker needle. Okay, so this one also has the indication of a half a milliliter, so that's good. So we need to alcohol prep the vial, uncap the needle, and pull back to 1, just a half. Okay, insert the air, pull. And you don't want to have any air bubbles. Okay, make sure it's the right dose. Okay, and then you want to make sure that it's the right dose, and then recap with one hand. Okay, so now we need to go into the patient's room. We need to ask for 2 patient identifiers. So name and date of birth, and his name is Skip Rocker, and his birthday is January 1st, 1972. And check for allergies, and he's allergic to Celebrex. Okay, so for the deltoid, you need to feel for the acromial process. So it's the bone that's like your shoulder bone. Okay, and then you feel for the end of the bone, and you go about 3 fingers down, and so you'll go like right in the middle. Okay, and you want the patient to be comfortable sitting, can be standing, you know, just have the patient relaxed. Okay, get some gloves. Alcohol prep the site. So sometimes you can find like a tattoo where it had like a dot somewhere, or you know, somewhere so you can remember where it was. So you got 3 fingers down, so right in the middle. Okay, then you alcohol prep it, uncap the needle, You want to pull the skin taut. And this one you do not aspirate, so you just inject and pull. And you don't recap the needle, and you just put the needle into the sharps container. If there's blood, you can dot it with a gauze pad. And you can put a band-aid over this one. You don't want to massage it. So now we need to document how the patient handled the medication. When it was given, you know, like basically writing down the 6 rights into a documentation. Yeah. And you want to make sure the patient is in a comfortable position.